Hello, thank you for reviewing parts 1 and 2 of this 4-part series. In part 1 and 2 we discussed device classification, identification of product code, applicable regulations, and identification of the substantially equivalent competitive device. In part 3 we will cover the information you will need to collect in order to prepare a 510(k) submission document. Let's get started. Here is the information you need to collect on both the competitive device and your device. At first glance this may seem overwhelming. The complexity illustrated here is one reason to use a 510(k) submission consultant versus trying to prepare the 510(k) yourself. But even if you elect to use an FDA regulatory compliance consultant, it is a good idea to listen to all 4 parts of this learning series. We will not go through each one of the topics on the slide. Rather, after you listen to all 4 parts, we recommend you go to our website and download the note pages for the presentations. Also, be advised, it may not be possible to gain access to some of this information for the competitive device. But don't despair, the FDA will accept 510(k) submissions, in which you enter the words "information not available" for what you can't collect. The lead reviewer at the FDA has access to the full 510(k) file for the predicate device. You will want to collect as much information from the FDA databases as practical to be able to make scrubbing the internet for information on the predicate device easier. You should be able to find most of the information you need. Scrub the internet for predicate device product literature, user manuals, instructions for use, MSDS sheets, and clinical journals for studies done with the device. Most of this information can be found with a standard Google search. You can use Google Scholar to search the medical journals. If you have not already done so, if at all possible, purchase samples of the predicate device. Once you have scrubbed the internet and collected the available information on the predicate device, you are ready to compile the information you need on the new product from your design history file and device master record. You will need to describe the performance specifications and include a description of the device design requirements, identify all models, as well as all accessories or components included in the submission. Collect diagrams, dimensions, tolerances, and/or schematics that fully describe and characterize your device. Have them for each model of device, accessory or component included in the 510(k) submission. Prepare a list of all patient contacting components and their respective materials. Test data is required in almost all cases, and in some cases clinical data is also required. After you have completed the collection and the product has been tested for safety in conformance to consensus standards, you should be ready to prepare the final submission document. In part 4 of this 4-part series we will cover preparation and submission of the 510(k). As always, any one of us at FDA Compliance Help would be happy to answer any other questions you may have, at no charge. We would also be delighted to discuss your specific situation and provide you with a proposal to help you get your device to market as soon as possible. Thank you for listening.